My name is Sabrina. Today I'll be demonstrating the MMT for forearm pronation and supination. For forearm supination, the muscle we'll be using is the supinator and the bicep brachii. For the supinator, the origin is the olecranon and the lateral epicondyle of the humerus. The insertion is the lateral aspect of proximal 1/3 of the radius, and the innervation is the radial nerve C6 through C7. The bicep brachii have two heads, the long head and the short head. The short head is at the supraglenoid tubercle, and the long head is in the capsule of the glenohumeral joint. Both are innervations by the radial tuberosity and are innervated by the musculocutaneous C5 and C6. To begin the testing, have your patient seated, have their elbow flexed to 90 in full pronation, and then have them supinate their arm, and that will be a grade 3 since you passed that. To check for a grade 4 and a grade 5, you stabilize the elbow and you have your arm on the dorsal part of their arm, on their wrist, and try to push them into pronation. For a grade 4 is mod resistance and a grade 5 is maximum resistance. Don't let me push your arms over, okay? So that will be mod and then that will be max. To test for a grade 2 and a grade 1, have your patient seated in a gravity eliminated position. Have their shoulder flexed between 45 to 90 degree and their elbow to 90 degree. Have their forearm in neutral position. To begin the grade 2 testing, stabilize their elbow by cupping your hands under their elbow and have them turn their palm towards their face. Turn your palm. Then she passed a grade 2. For a grade 1, you basically palpate for the supinator, and if you feel a contraction, then that'll be a grade 1. And I did. For the forearm pronation, there are two muscles involved. The pronator quadratus, the origin for that is the distal 1/4 anterior surface of the ulnar, and the insertion is the distal 1/4 anterior surface of the radius, and it's innervated by the median nerve. The second muscle is the pronator teres. The origin is the humeral head at the medial epicondyle and the ulnar head at the coronoid process of the ulnar. It's inserted at the lateral surface of the radius midshaft, and it's innervated by the median nerve. To begin testing, have your patient seated and have their elbow flexed to 90 degree, fully supinated. Now have your patient pronate their arm, turning it downwards, and that will be a grade 3. To test for a grade 4 and a grade 5, you support the elbow and you add resistance by holding the patient arm at the dorsal side and add mod resistance for a grade 4 and max resistance for a grade 5 by trying to supinate your forearm. Don't let me supinate you. Don't let me pull your arms over. That will be a 4, and that will. To test for a grade 2 and a grade 1, have the patient sit in a gravity eliminated position, their shoulder flexed to 45 to 90, and their elbow flexed to 90 degrees. So we'll be cupping her elbow with your hands and tell her to move her palm away from her face. Move your palm away, and that will be a grade 2. For a grade 1, you'll be palpating for the teres, for the pronator teres, and when you feel that contraction, that is a grade 1.